Hi, I am Dr. Surekha Tiwari. I am a practicing homeopathic doctor and a psychological counselor. I've been in the profession for the last 35 years. I have my clinic in Bangalore. Somatoform disorder. The word soma means the body. We say psychosomatic disorder. When the mind is disturbed, the body also suffers. Somatoform disorders are those disorders where the body has a little pain or the body has a little issue and the mind suffers. I think this is very common these days. With the first hint of a hair fall, people come running to us, oh God, will I go bald? I'm not able to sleep the whole night because I'll go bald. Then somebody will come and say, oh, I've got these marks and I don't want these marks. Fine, we'll treat it. No, I don't want these marks. I feel very bad about myself because there are marks on my face. I recently had a lady coming into the clinic and she had some problem in the nail. There was a nail which had gotten in the door. And she's like, please, can you do something about it? Can you give me some medicine so that the nail comes out in 2 weeks? I don't like my finger. Now, whoever is listening, who you would think that, these are normal or these are abnormal reactions. Any reaction which is within its own limits. When you say limits, you mean what? That yes, we all like to be pretty, we all like to be beautiful, we all like to be healthy, we all want to be pain-free. But when it gets in the way of me being peaceful, that's when you say that, now the mind is getting so upset with a little pain, a little disfigurement, or treatment as it takes time. However, how much time or how much space you give that treatment to go in its way and you will be fine. See, the bottom of the spectrum would be something known as hypochondriasis. For every little thing, a person gets very anxious. Oh, today I didn't pass the toilet. Maybe I'll get piles. So there is an extrapolation of the imagination. That somatoform disorder will lead somebody into fearing each and every deviation, however small the deviation. And this disorder can lead to so many other attacks of panic. I have seen panic attacks with people. They got one reading in a treadmill test. There was this gentleman who came, his heart rate went up to 140. So his blood pressure shot to 210. He was just 32 years old at that time. And I met him today and he's still 37, still eating medication. Why do you need medicine? He says, no, I don't want my blood pressure going up. I don't like it. Do the other things. Why don't you do some pranayam, do some walking, take care of your diet? Oh, that is okay, but I don't want to see my blood pressure reading going up. These are extreme reactions where a little change in the soma is causing so much and a disproportionate change in the psyche. Generally, again, if we look at all the disorders of the psyche, there would be a background. Either they've seen somebody falling very sick very often or suffering because of sickness, or they have a fear that if something happens to them, then there will be nobody to look after them. Somewhere it starts from a fear that if they fall sick, they will not be able to manage. But when that fear overtakes to become almost like a disorder, there is a very fine line. So here the technique of CBT, cognitive behavior therapy, works. In cognitive behavior therapy, there is a technique which is also known as cascading. In this, what we do with people is that you keep on tracking back your thought process. So you have a thought, okay, why do you think you have this thought? And from there on goes this discussion, whereas somewhere as you go back in your life, there would be a moment, there would be an incident, there would be an example which set out this process in your brain, which said that anything happens, it's not, oh God, I can't take it. So when the reaction to a disorder is disproportionate and makes you very, very unrestful, unhappy, and that unhappiness interferes with your daily life and daily routine, that would be called somatoform disorder. And it has its treatment through psychotherapy and psychological counseling.